It's 25 after 6. Jay has the sports report, what's going on, and there's all sorts of news continuing on. We have some great news, though, about response on COVID, and that has to do with people that are trying to get doctors relicensed. Doctors who have retired and quit, but they still want to help, and yet the regulatory state says you're not qualified. Well, there are groups working on that. We'll share some information about that coming up here in the next few on KMED and KCMD, and this is the Bill Myers Show.
You're waking up with the Bill Myers Show on 99.3 KCMD and FM 106.7 KMED.
One of the biggest challenges is getting trained medical officials and people and personnel where you need them. So there are a lot of people that are coming down with COVID. Wondered about that because my sister-in-law, Holly, is an RN, North Carolina. And she's in a self-quarantine right now because just a few days ago, she was sent to do some work at an assisted care living facility in North Carolina where she was contracted to work. And then we ended up finding out that there were 3 elderly patients there who ended up having the virus. And so is she getting it? No, they're testing her all the time right now, swabbing her up. She's at home in isolation. And my brother Mike is they're staying apart here for right now. Everybody's getting tested right now. It is a serious issue, but yet that's just one small example of one registered nurse out of the system. And then what do they do to try to keep things going? Well, Niels Andersen is president and CEO of MedCV. Niels, it's a pleasure having you on. Welcome to the program.
Thank you very much. Good morning.
Niels, what is MedCV and what is the mission and what got you this idea and where's this all going right now? Give us your lay of the land. What do you say?
Sure. Well, our history has been in helping hospitals and health systems to recruit and retain their medical staff. So we have clients all over the United States, from Kaiser in Hawaii to Advent Health up in your neighborhood and down the coast, West Coast, and many other large health systems there.
Are you working with, let's say, Regents Blue Cross? Are you working with Providence or Asante, anything like that? Does any of that come to mind? I'm just kind of curious.
Yeah, I wish I had a list of everyone. So obviously, we'd love to have everyone.
Sure.
We could help. But I'm just rattling off a couple of key ones.
So when you say MedCV, is that then, are you essentially a headhunter of sorts? Would that be a good way of describing it? I'm just trying to make sure I understand where you're coming from.
Right. No, we MedCV is a byproduct of the applicant tracking software that we help hospitals with, because hospitals need doctors. So it made sense for us to build a technology to help doctors and to manage their credentials so that they could be onboarded quickly. They could find their next great job or their first new job after training. And then, of course, with this crisis, it harkens back to what we experienced here in Pensacola, Florida, where we had Ivan hit and devastate our market with our communities with a hurricane. And then, of course, everyone knows about Katrina as well.
Sure.
And back then, we were thinking, we started to build out a structure where we could rapidly identify medical providers. In this case, we focused on physicians and what we call advanced practice providers, which are physician assistants and nurse practitioners, so that we could have a kind of a rapid response team or a profile of people where they would kind of a pre-stage, so to speak, where they could identify, I'm willing, I'm able, I can deploy within 24 hours, 48 hours, 5 days, whatever, and here's what I'm willing to do. And the distance, too, within 25 miles, 50, 100, 500 miles, anywhere in the U.S.
Okay. Now, what you're doing right now is working with retired doctors and healthcare workers and trying to get them relicensed. And I find it really interesting because I know there's just within my own neighborhood, right down the street, there's a couple of doctors who are retired that I'm aware of. And I wonder if they would be willing to be pressed back in service. I don't know. I don't know if they're still licensed or not, but that's kind of what you work on with MedCV?
Well, that's our newest mission, right? I mean, the focus had not been to try to recall retirees, until recently. There's a large government agency that has helped, that we've helped in the last 4 or 5 days to try to bring back everyone who has retired from that organization in the last 12 to 18 months. So we built some technologies overnight to help them with that mission. But as an example, the survey we just sent out, So the sample size isn't really large enough to be statistically correct, but what we're seeing so far is that 69.5% are willing to deploy, and 26% say maybe.
That's really interesting. So 7 out of 10 retired medical experts then, or professionals, are willing to come back and help out during the COVID crisis, if you want to call it that, and the remaining 3 out of 10 are saying like, well, maybe, right? So they could be convinced at some point. Now, what kind of regulatory hurdles does a retired medical professional have to surmount in order to get back into the game right now during an emergency?
Yeah, I'd like to emphasize too that you got to remember, it may not only be retired personnel, right? It might be people that are in a perfectly healthy community that needs to be deployed or be willing to volunteer into a hot zone.
Yeah, you're living in a rural area in Oklahoma, and there's nothing going on there, and you'd be willing to help, as an example. Just to throw that out there.
That's exactly right, and you mentioned it as well, and it is so true. What we have to be careful of is that we can probably expect 20 to 40, maybe 50% of the people who are there today taking care of sick people are going to be infected. I mean, that could be up to half of our physicians and nurses and et cetera.
And if they're infected and yet healthy, maybe most of them make it through it okay without too much problem, but they could get sick, right? They could be getting sick, but they would certainly be able to be a vector of transmission too, so you can't have them working when they're...
That's exactly right. Well, you don't want someone who's testing positive to be seeing patients anymore, right? So now what? We have to have them to consider, how do you work from home then? Because just if I was a physician and I was positive, but I have no symptoms, I still want to do my part. And so maybe I can turn to telemedicine.
Hey, that's a great idea. I hadn't thought about that. So the doctor's asymptomatic, is not having problems himself or herself, and then tell them that would work, right? At least you could start talking to other people and say, okay, how are you feeling? Let me look at your tongue, on the, I don't know if you do that on the, on telemedicine or not.
Well, I think some of the lifting of the HIPAA regulations has helped a lot with that, and I think people are still trying to figure out what that means exactly. But from on the far right of the scale of that, it could be construed as you can now use your cell phone to do telemedicine without having any other infrastructure necessarily to worry about. If your patients are sick or people are sick, they need help, and that's what your Hippocratic Oath is all about, right? That's why you got into medicine in the first place.
Sure.
And so you want to help. But it's not just physicians. If they're nurses, like is it your cousin that you mentioned?
Yeah, my sister-in-law. Sister-in-law was at an assisted care and ended up getting exposed to it. We don't know if she's infected. It was just a brief contact, but one never knows. And so at this point, it's kind of sit home and wait.
Well, and so if she's feeling fine, and we have to think about how we repurpose all of our assets, including nurses, because there are family members that are worried about their moms and their fathers and their grandfathers that are in these nursing homes. Maybe your sister-in-law, as an example, I'm just throwing out ideas, should be set up to be able to call patients' families to manage their expectations, right?
Yeah.
There's all kinds of emotional support and or just communication that is so important today about people that are sick. And now that we can't go in and see our loved ones in the hospital or in a nursing home, that kind of communication is critical. And those nurses that are at the hospital seeing patients that are overwhelmed with a massive census that they've never seen before, they don't have time necessarily to field those calls that are coming into the nursing station.
So that might be a way that even if you're infected but still feeling okay, you could still help in here. Niels Andersen, once again, President and CEO of MedCV. Is that the website for your organization, too, if people wanted to join and actually try to help out in the situation, sort of a clearinghouse of medical professionals? What is that website?
Yeah, so MedCV is an app that was originally designed for physicians and advanced practice providers where they could register and keep track of their credentials. Mm-hmm. In this case, in the crisis, we encourage people to do that. And then also we're building out, should be live either this afternoon or tomorrow, this profile where you could say really what your availability is in the event that you are willing to be deployed to some location either to a local hospital or an agency, a federal agency or whatever. We just want to be able to get kind of an idea of what the force availability is.
And what I understand here, Niels, is that a lot of the retired military healthcare workers seem to be really big about getting back into the game. Isn't that the case?
Well, that's a perfect. You're exactly right. So I'm former military, and here's an example. I was a Navy corpsman. In case your audience doesn't know what that is, that's a medic. That's what we call ourselves in the Navy. I went to college in the Navy. Mm-hmm. But most of us who join the military or do these kinds of things, we do it for service. And when I got out as a Navy medic, teaching advanced life support, teaching new doctors how to do all the suture, being in charge of all my enlisted personnel in the largest Navy hospital emergency department in the world, I couldn't get out and drive an ambulance. So what we're asking now, we are just announcing today that we're opening up MedCV for former military medics. Because if you have got that experience, if nothing else, if you need to be deployed, you know the basics. You can do vital signs, you can do triage, but more importantly, you've already been taught how to manage infectious disease, how to gown up, and how to disrobe successfully without, turning everything inside out, opening up sterile equipment, and all those kinds of things. So there are a lot of people, I think, to your point, that are former military that are would be willing in a heartbeat to serve again, right? Not to be active duty, but just to be part of the mission. And I think that's very important.
And to be available if you're needed. And we don't know as time goes on, we may have the need because, like I said, even within my own family, we have someone who has been exposed and is out of commission and yet was out there working hard, working lots of hours in the medical world, trying to keep people healthy throughout this year. How do they get in touch with MedCV? What is that process? I want to make sure that we have this clear. Okay?
Yeah, just go to medcv.com. If you're a healthcare provider, I don't care what specialty you were, or if you haven't done this for 15 years, create an account. It takes 30 seconds to create an account, and then we'll have instructions on just doing the essentials. The only thing you need, if you're a physician, the only thing you need to update or make sure you've added there is probably your NPI number, your license status, because there's also the lifting of licenses required per state. So, for instance, if I was here in Florida and there was an emergent need for physicians in Oregon, I don't have to go through the state licensure process in Oregon to be able to practice there and help you. I can get there right away. So that's been lifted, and that's important. So and then put some information in about your drug enforcement, or the DEA we call it, and substance control, just your medical education and the training, where you did a residency and a fellowship. Those 5 things are the only things that you should probably worry about in MedCV. You can do a lot of other things, but forget about all that right now.
Yeah, right now we're just trying to get a tally on who is willing to go where help may be needed at some point, and we'll work through the paperwork. Let me ask you about that paperwork in the medical industrial complex, if you want to call that. One of the biggest challenges we've had has been paperwork and rules. In fact, we'll even look at essentially where we fell down on the job here with COVID, Niels, is that we have this siloing, the CDC essentially saying, well, the only test we're going to use is the one that we make. And I think we see that didn't really work out so well at first. All right. There's a lot of this going on. Is it time to get away from, even though I'm a big fan of federalism, is it time to eliminate this individual state licensing for medical providers and go to, well, as an example, if I have a driver's license, I can drive in any state and nobody thinks anything of that. Not a problem at all. But yet when it comes to medical professionals, oh no, don't even think you cross this imaginary line and then you are a persona non grata when it comes to actually practicing what you're trained for.
Well, I think you have a valid point, but you got to remember we have probably more lawyers per capita than any other country in the world, right? Mm-hmm. So that's probably the biggest hurdle. So I think that's a worthy goal to try to identify, maybe work on after this crisis. Right now, though, fortunately, we have the presidential power to lift those things, right? So that in case of a pandemic or a national or regional emergency, the federal government has the authority to lift those kind of requirements to get people where they need to go.
But it seems to me, long term, that if the president has the ability to lift it because it is a public good during an emergency, it really is an indicator that it's not necessary, really, in the long term. And everybody is into turf protection mode. We know this is what this is. And every state wants their own licensing board. Every state wants its own set of fees. Everybody, you see what I'm getting at? And I just don't.
Oh, absolutely.
I don't think it's helping us right now at this time. But MedCV, from the looks of it, certainly is. At least it's a potential way to get people involved who want to help out, who may be retired and or are willing to join the ranks here. MedCV.com, MedCV.com. And Niels Andersen, we really appreciate you coming on. Thanks for telling us more about this. Some good news, some people really getting to it and getting ready to help. Take care.
Well, this is like 9/11, right? And I know that we're trying to use our skills and technology to help America today, and I think we can also help America tomorrow with things like you just mentioned.
All right, Niels, thank you very much. You have a great day. Thanks for telling us more about this. MedCV.com. It is 6:56 at KMED and KCMD. You're on the Bill Myers Show.